Job today for plantar fasciitis, and I'll demonstrate two different types of tape jobs. We'll start here on the right foot with what's called a low die, L-O, L-O-DI, and then on this side we'll do a variation of the low die. So for the low die tape job, you're going to need a roll of 1-inch Zonus porous and a roll of 2-inch Zonus porous. And you'll start with your 1-inch, and you'll measure out, come down a little bit, measure out your lengths from the base of the first metatarsal phalangeal joint around the back of the calcaneus to the base of the fifth metatarsal phalangeal joint with the back side of the tape so it doesn't stick. Okay, from first MTP to fifth MTP, that's going to be the length of your tape, and you're going to need 3 of those strips. Take those 3 strips. Then, with the 2-inch, you're going to measure similarly from the base of the first MTP joint to the base of the fifth MTP joint, but this time we're going to go across the bottom of the foot. From first to fifth, and that's the length of tape that we'll use. Times 3. Okay, and so now we're ready to begin. So you take your piece of 1-inch and adhere it tightly to the base of the first metatarsal phalangeal joint, making sure to hold it securely in place as you traction and stretch the tape around the back of the calcaneus, pulling tightly to attach the tape to the base of the fifth metatarsal phalangeal joint. Smooth out any folds or irregularities and make sure that it's securely adhered. And take your second piece, and we're going to overlap the first piece by 50% here in the front. This creates a greater surface area for later pieces to attach to. Okay, and then pull securely around. Make sure to overlap 50% at both ends, overlapping 50%. Then you're going to take your 2-inch tape, and we're going to use the 2-inch tape to create an artificial plantar fascia across the bottom of the foot so that the actual plantar fascia can have a little break, a little holiday, can have some rest. This is going to absorb some of the load from the natural plantar fascia. So it has to be adhered securely. So grab your 2-inch tape firmly between both hands, and leaving a small space open at the heel, firmly, and give me a little pressure with the knee, firmly secure that tape. Has to be secure because it's going to sustain the whole weight of the body as the person steps down on their foot. Okay, we're going to overlap the first piece by about 50%. Attach it securely, and notice the amount of pressure that I'm applying, and push with your knee. And then a third strip, again overlapping the second strip 50%. Now on a person with a larger foot, we might need 4 strips. On this patient here, we're getting the job done with just 3 strips. Good. So we've got 3 strips of 2-inch tape now across the bottom. Then you're going to take your 1-inch and secure all the loose ends so that they don't come undone. And also, to make it look real pretty, you just simply tie down those loose ends with your third piece of 1 inch. And then there's the basis of your basket. We've actually created a basket underneath the foot that will support the weight of the body as the body weight comes down on the foot. Now the piece that makes the whole thing and ties the whole thing together comes at the end with your 2-inch. So you're going to again measure from the base of the first MTP to the base of the 5th MTP with a strip across the top. That's your length. Tear it off and use this as a double backing. That way we don't irritate the skin on the top of the foot. Attach that to the center of a piece approximately 3 times the length. And this is going to be the final piece. Now, the final piece is going to lay across the top of the foot, just posterior to the base of the first MTP and the base of the 5th MTP. You lay it across there, attach it underneath the bottom loosely. Notice how loosely. I'm not pulling this tight, I'm just attaching it loosely. And then, while dorsiflexing the foot maximally, and I'll do it. Doctor dorsiflexes the foot maximally to expand the foot volume. You lay this top piece across the top of the foot loosely, only to finger tension here, not pulling, loosely. And make sure that there's no folds or seams underneath the foot that would cause discomfort. And then if you've done the whole tape job properly, when you let the foot go, should be loose here. If you're not able to get your finger underneath the edge of the tape, it's too tight, it's going to irritate the foot and you'll have an angry patient. So it should be loose, because as the foot goes into dorsiflexion, foot volume expands and the tape becomes tight and constrains the expansion, thereby relieving pressure and pull on the plantar fascia. And that's it. And if you really wanted to make it pretty, you would seal all the edges with candle wax, and that would help it survive the shower better and make it last for about 4 or 5 days. But that's the basis of your low dye tape job for plantar fasciitis. Boomo.
Showing off the foot.
Okay, and so now we're going to do a second type of tape job, which is a modification of the low dye tape job. And the reason for a modification of the low dye tape job is that the low dye tape job is a very secure and very solid, almost like a cast for the foot. And the low dye tape job is great for people that are going away on vacation, or people that may be playing sports and need maximum support. Well, there's also a population of people that need support but don't need as much or as heavy of a tape job, and so we have a modification that I'll show you now. For this, you need a roll of 1-inch elasticon tape, which is stretchy tape, and then 2-inch of Zonus porous. So we'll start with the 1-inch elasticon, and we're going to measure 3 strips from the base of the first metatarsal phalangeal joint, around the back of the calcaneus, to the base of the 5th metatarsal phalangeal joint, while stretching the tape. This tape stretches to approximately 130% of its resting length, so we want to take that stretch out when we make our measurement. Okay, and so then we'll repeat that measurement for 3 strips, remembering to take the stretch out of the tape. Show that up here. Okay, and we'll start with our 1-inch elasticon, and we'll adhere it to the base, the first metatarsal phalangeal joint. Take the stretch out of the tape, wrap it around the back of the calcaneus, take the stretch out of the tape, adhere it to the base of the 5th MTP. Repeat 3 times in exact overlap. Take the stretch out of the tape, exact overlap. Now what this is doing is this is taking the back part of the foot at the calcaneus and the front part of the foot at the metatarsal phalangeal joints and drawing them together and compressing that space, thereby taking pressure and traction off the sensitive plantar fascia here. So for that reason, you want to take all the stretch out of the tape, and you want to pull securely across the calcaneus and draw that calcaneus towards the front of the foot. And notice how I'm doing that, pulling hard on this tape. And we got a little extra tape there. I'll cut that off. Secure that. Okay, and so that's a nice solid band, a rigid band that's drawing the 2 halves of the foot together. And then we'll secure those with our 2-inch. 2-inch, measure from the base of the first metatarsal phalangeal to the base of the 5th. Tear that length of tape off, use it for double backing. Tear off a piece of tape approximately 3 times the length of your double backing. And then we're going to use this to secure the whole assembly. So we simply lay this across the top of the foot, secure it loosely underneath, and notice that I'm not applying any tension or pressure to the tape. I'm simply laying it across there very loosely. Then strongly dorsiflex the foot to maximize the foot volume, and then very lightly, and notice that I'm just pulling on this to finger pressure. Really it's just the adhesive that's sticking to my finger here. That's all the tension required. Just lay it across the foot, attach it underneath, take out any bumps or folds, make sure that it's securely attached, and if you've done it properly, it should be loose here across the dorsum of the foot. And there's an alternative tape job. It's an alternative to the Lodi that's a little bit lighter, not as constraining, doesn't require as much tape, and allows a little bit more freedom of movement for those that don't need the maximum support offered by the Lodi tape job.